If somebody starts getting hearing loss that becomes obvious to other people, what are some of the symptoms that they have?
So most commonly, the things that we're seeing people for that we end up diagnosing with hearing loss are, number one, ringing in the ears. That's one of the first things that people will notice.
What's that called?
It's called tinnitus. It's often called tinnitus, but that's a slight mispronunciation, so it's called tinnitus. And that's when you have ringing in the ears. Sometimes it does sound like a high-pitched ringing. Sometimes it's more like crickets, or it's a more of a dull roar.
When I'm on the phone sometimes, somebody's speaking too fast and I have to say, slow down. Is that a sign that I'm not hearing well?
It may be, yes. So if we have any decrease in our ability to take the sound in and have it come to our brain, then things like rapid speech or speech in noise situations, so that's the kind of the classic cocktail party effect, where if you're trying to talk to somebody face to face at a cocktail party and there's a lot of surrounding noise, any little degree of hearing loss will be really heightened at that moment because your body will have trouble discerning what's the real sound to pay attention to and what's the background noise that you want to try to cancel out.
Has that got a big, long medical name for it, a doctor talk, presbycusis?
Presbycusis is, yeah, that's a good way of, that's one of the ways that you could describe that. And it's very common seen with presbycusis.
And so that's when an old fogey gets in a restaurant and he can't hear the conversation across the table because of all the noise in the room. Can that be helped?
It can. It's luckily one of the things that responds really well to hearing aids.